total cost of U.S. drug expenditures exceeds $360 billion every year. Medication therapies are becoming more complex, creating an increasing demand for board-certified pharmacists.
The Board of Pharmacy Specialties was established in 1976 as an autonomous division of the American Pharmacists Association. Our mission is to improve patient care by recognizing the special knowledge, skills, and abilities of pharmacists to practice in specialty areas through our board certification process.
Over the past 10 years, there has been a 400% increase in the number of board-certified pharmacists. Today, BPS certifies more than 35,000 pharmacists in the United States and 26 countries worldwide.
The rigorous standards, both for eligibility and testing, makes these individuals among the most qualified to manage complex patients and the increasing demands of healthcare delivery today.
BPS board-certified pharmacists design medication regimens, monitor for and prevent adverse reactions, recommend the most cost-effective treatments, and work collaboratively to improve patient outcomes.
I work with the team, the physician team, and the advanced practice providers to help design the medication therapy for patients and as well set up the monitoring plan for them. I do extensive patient education.
I think as the pharmacist on the team, I dedicate my responsibility to being the sole person for medication outcomes. So making sure that we choose the right medications, that we're monitoring for safe and effective outcomes, and then individualizing that therapy to make sure we've chosen the best thing for each specific patient.
I really love working with older adults, and what I get to do is help them on a daily basis with their medications. That can be anything related to reaching out to them to help manage their diabetes, or to pare down their medications and make sure they're taking the right medicines before they come back to the physician for follow-up.
From working in nuclear pharmacy to providing care to newborns or seniors, board-certified pharmacists are uniquely qualified to provide an advanced level of care.
I have found it personally rewarding to be a board-certified pharmacist and pharmacotherapy specialist. I think we all have our areas of pharmacy that we really like to excel in, but at the end of the day, we need to take the patient in totality and really think about how medications impacts the patient.
It helps me take care of my patients in a more beneficial manner, and I think it gives others confidence in my abilities as well.
It spurs me on to stay up to date and focus with new information with respect to the treating of patients with infectious diseases.
When they see you're board certified, that means a lot to them, and it adds credibility to what you're recommending.
It's an additional credential that adds credibility to my own experience and practice as a pharmacist.
My background is in infectious diseases, and so being just a board-certified pharmacotherapy specialist keeps me in the loop with some of the things that I don't encounter on a daily basis and enriches my experience when I'm rounding daily with the infectious diseases consult team.
The value of the BPS board-certified pharmacist registers throughout the healthcare continuum.
When you're dealing with an era of ever-increasing medicines, medications with innumerable complications, having a board-certified pharmacist as part of that core healthcare providing team is as important as any therapeutic agent or therapy we've provided clinically that I'm aware of.
And our pharmacists here in particular are just incredibly bright, incredibly talented, and incredibly dedicated to evidence-based patient care. And it just adds so much to the overall care team.
They bring that clinical knowledge and that knowledge of of the pharmacology of medications to bear, where I think physicians don't have that expertise.
As medicine has become more specialized, they play an important role in terms of monitoring not only which drugs we use for various conditions, but also concentrations, the dosages of the drugs.
BPS board-certified pharmacists, taking healthcare to the next level.